According to Healthline.com, between 3% and 20% of Americans experience irritable bowel syndrome. The condition affects more women than men. Some people with IBS have minor symptoms. However, for others, the symptoms are significant and disrupt daily life. IBS doesn't increase your risk of gastrointestinal cancers, but it can still have a significant effect on your life. In today's show, we'll be exploring irritable bowel syndrome and all that surrounds it. Are you ready for another chronic pain conversation? Let's go. Hello, and welcome to Chronic Pain Conversations. My name is Sharifa McLaren Thomas, and this is my lovely co-host, Khalilah Bruzuel. This is a show where we have open and honest dialogue about chronic pain. We share on our experiences, acknowledging the wide variety of chronic pain diagnosis, and look at ways to manage chronic pain. So, of course, we're going to jump right into pain or pleasure to get a status up on where both our bodies are at for this show. So, Khalilah, pain
yes,
or
my love.
Pain or pleasure?
Both. Pleasure because I'm on a new journey in a different aspect of my life. Pain because I haven't been able to sleep. My sleep's still been off. It's really funny. When I don't sleep in the new massage chair that I got, Sharifa, right, I'm not sleeping. And I think what's happening, and I don't know if other chronic pain sufferers are dealing with this as well, but because we're having such drastic climate changes and it's changing and affecting us, it's just making it really, really hard to do it. So that's what's going on with me. But talk to me about you, my love. Pain or pleasure?
I am pain today, like physically. Yeah, like you said, the change of climate, it's been raining on and off, so that's definitely affecting my joints and stuff. But for the most part, I can't complain. Like, there's so many other people in worse situations than us, so still just giving thanks for life.
I'm glad to hear that, my love. Okay, so let's get into our topic today. So we have got this thing, what we're talking about, IBS. And this is actually a conversation that's very near and dear to my heart because I actually suffer with it. So I'm not sure if our audience knows or not, but IBS actually affects women more than men. A significant proportion of about 35 to 40% of individuals who report IBS in the community are male, and 60 to 65% are female. So studies are asking why. And they say it's because the intestine's nerve cells are more sluggish in a woman. Like, we have to sit back and think about how a woman's body moves and all the things that we actually are capable to do. They say that sex hormones and gender differences may play important roles in the pathopsychology of IBS. So women may tend to have symptoms around the time of menstruation, or they may have more symptoms during after. They won't have as many symptoms after menopause. And some women have also reported symptoms increasing during pregnancy. So I find that, like, when you pulled up the research on this, I found this to be extremely interesting, that it flows in terms of where your stomach, I mean, it is a stomach issue. For those that don't know, IBS, irritable bowel syndrome, is this, it's dealing with your stomach and your intestines. So Khalilah, we picked this topic. What are your first thoughts when you hear this? You do this research, like, what's going on? Tell me, mama.
I feel like when I hear this about, the symptoms that we like women will get it around time of menstruation, and it's increased during pregnancy, I feel like it kind of makes sense to me because, like you said, our bodies compared to men are made differently. Mm-hmm. We are made to do different things, especially when it comes to like giving birth, when it comes to, releasing toxins out of our body. So it kind of makes sense because during this time, our bodies women's bodies are always going through changes.
More than they know.
No, at this point, every month, we're going through changes, like no matter how simple or how, big it is. So it does make sense to me that, women would experience this more than the male. What do you think?
So it's really funny because the stats, like when you pulled up the stats and I was reading it, I was like, it's true. My eating habits always have to change, specifically around my period, or they have to change when I'm stressed out.
Right.
And I want to give people this understanding in terms of IBS is kind of like your stomach. When we talk about irritable bowel syndrome, your stomach inside of you is hurting. It's inflamed. Things that would be okay for other people to eat, your body, your intestines might have a sensitivity to it, or you can't process it as easy as other people. So let's talk about beef or shrimp. That self is a little bit, it's too hard to digest for a lot of people. And then when you have something that's in your body itself and it's causing you not to be able to process it the same way, it's causing food to stay in your body and pile up more. It's my chiropractor who gave me the biggest information about this said, I said, my back can always hurt around that time. She's like, well, think about this. You got food and it's going down your stomach, but your stomach's like not right in the front, but it also comes along the back. It's around your ribs. So if I'm having issues and my IBS is flaring up and it's taking a very slow time for it to go through my body, all that, a meal could take 2 days to go through my body, right?
The
and
way
then you starve yourself. Say it again.
I think about it as like it's swollen, so it's hard to do work when
it's sensitive.
Right.
And we already know if we touch our skin on the outside and if it's swollen, we touch it, it hurts. Why isn't it the same thing on the inside? So I think that's really why I really want to have this conversation today because, sometimes, especially with invisible disabilities, everybody wants to see something, but this pain, this chronic pain, can literally, you won't see the pain it's causing, but you'll see them in pain. You'll see them keeled over. You'll see them crying. You'll see them in a lot of distress. So it's not that you can't see it. You see it. You just don't see the actual wound, kind of, if that's making sense.
Absolutely.
Okay.
So did you know that there are many other conditions that can overlap with IBS? So we're talking about like hemorrhoids. There's a thing called rectal bleeding as well, and IBS relates. Mm-hmm. You have heartburn or gastrointestinal reflux disease, which is GERD.
Mm-hmm.
We have intestinal parasites. We have thyroid problems, gallstones. There's a lot of things that overlap with IBS that I even feel like with the overlap, it can be easily mixed up.
It can and it can't because there's two different things. So for example, the GERD is here and down, acid reflux, before it actually gets fully into your stomach. So it's already inflamed up here, right? But then your IBS is inflamed in like your stomach and it's the rest of it. And so just the same way that your stomach has different parts to it, there's different things that are getting mixed up or hurt from it, right? And so think about this. Think about you having a carrot, right? And a carrot can be tough when you eat it. And your body can't properly break down the carrot it needs to be. So what's happening is as you start, that carrot goes down you, it's scratching, it's causing all this irritability into your intestines, into your lining. It was really funny. At one point, I say carrots because they're my friends, but they're not my friends. And I had carrots one day, a bag of baby carrots, which I love. And my body was so off and I was so stressed out and my IBS and my GERD flared up that after I tried to drink water for 2 days later, I was in pain. Like the purest thing that's supposed to heal you was causing me pain because the food that I had put in before had irritated my lining. It's not fun, mama. It is not fun.
Okay. Did you want to say something?
No, go ahead.
Okay, because I was going to say, you're telling me it's not fun. I really want to know your experience with IBS. So please share with us your story when it comes to dealing with IBS.
Okay. I'm going to take you guys through this as fast as I can. So I had 5 deaths in my life 5 months in a row, back in like 2015, 2016. So it was either somebody that I worked with, somebody that was a relative to somebody that I loved, or so January, February, March, April, May, my body was stressing. And so not only is my body stressing, but now the stuff that's going in it, because my body's stressing, it can't handle the everyday food that I was putting in it, right? It's a lot of stress to go through death. Let's not play that it isn't. So I got to a place where all of a sudden I was just in pain. Like I was keeling over, and I was crying in pain because I didn't know what was going on. So I remember one day my mom took me to the hospital, and I was in there for like 8 hours in the emergency room, and they drugged me with so much stuff, and they still couldn't ease the pain. They couldn't figure out what it was. And they actually had to send me home and like, we need you to go to see a gynecologist or whatever. So you come home from the hospital, and then you got to have that waiting time to go and see the specialist. And then I go to see the specialist and the gynecologist, and they're like, it's not one of our issues. Maybe you need to go and try a gastrointestinal. So it's really process of elimination. From the onset of my what I didn't know was IBS, took a year and a half to get the diagnosis. Okay. And I went to a gastrointestinal specialist at the hospital, and she actually had to take the scope. I don't know if you guys know what I'm talking about, when they put the camera down your stomach, and it can go one end or it can come out the other. So she went down the front way first, and she could see it. Like, what's really funny is that they can actually see it. Like, I want you guys to know that's how I got my diagnosis. Because when she went in, she could tell that this is not the way that your body is supposed to be reacting. This is not how your lining is. It's all reddish. It's all of these different things. So I was like, okay. And I had to learn, you have to change your diet. Because the funny thing about it is when I went through those 5 deaths, I was trying to eat healthy. I was trying to eat my greens. I was trying to eat like everything to make my body have good fuel in it, only to find out that some of that very good stuff, the broccoli, the cauliflower, the carrots, like all of this stuff, this was actually hurting me. So we're sitting here and there's that nutritional guide, and all of a sudden you find out it's not helping you because your body's not handling it. So over the years, I've learned that, you hear different things. Blood types affect what your body can digest and not digest. Stress, what it can and can't digest. And this is why I stress to you guys, like our audience, your body does tell you things, and your body does, we go through stuff. So don't ignore the signs. Please, please do not ignore the signs. Fast forward, I got to a place where I thought that I was balancing it off, and then the car accident happened in 2017. Mm-hmm. That set my whole body right back off, because your body's been traumatized. And there was about a whole month that mashed potatoes, just mashed potatoes, Sharifa, would make me cry. And I was just like, I can't live like this. And and you're like, well, do I always have to live like this? And then I found out, in them doing more search, the accident had actually caused me to have GERD, which is why you're talking about. So I had the trauma from, like, I guess the whiplash and all those other things. And that ended up just my whole system, just everything inside and out. And so if I get stressed out, if I eat too much of the wrong food, not only do I have IBS and GERD, but I have I'm lactose intolerant. So if you add all these little things together, you're irritating the inside of your stomach. We have to watch what we put in our bodies, you guys. You have to watch what you put in your bodies. And it's not just about the junk food. Like, the fact that I was trying to eat really well, and that was hurting me, was such an eye opener. And so it varies. I saw Miss Nikki, she came up with the post and she was like, shrimp. And I was like, shrimp is rubbery. Beef, when we Black people, we like to cook our beef till it's like well done, and it becomes more rubbery and it becomes more hard for our bodies to digest. And so when you're dealing with something, and then all of a sudden your body changes when you're on your period. Sorry, guys. But as a woman, your body changes, right? The fact that, it's not just that you're having your period, but the inside, to hold everything that's happening, when you're pregnant to hold a baby. It moves things, it shifts things, it pushes things into other directions because it has to make room for the baby, has to make room for your menstrual period, has to make room for all of these different things. And when it shifts it, it now doesn't allow space for your stomach lining to push things through as easily. So now what was like this big has now become this big, and a piece of food that, you know, when it was big enough could go through like this, when it gets smaller, it can't, it's hurting. Is that making sense when I say that? So
sense.
It's always changing. I have to watch what I eat. But here's the joke about it. I still find it as a blessing, Sharifa. And I find it as a blessing because it means I have to take care of my body. And if this is a position that I have to be put in so that I have a longer life and I really listen to my body and I only put good things into it, my life is actually going to be longer. I don't know if that makes sense. You get what I'm saying? Yep. Okay. That's your...
Okay. So you were saying that your symptoms were you were finding it really hard to, like, I guess, swallow food. The simplest things, like you said, water was just hurting. Some people experience weight loss. And I would say, is that because they're afraid to eat?
I don't know if it's necessarily afraid to eat, but you can have weight loss because the foods that you were having before, once you have IBS, they could really be damaging your body. And if they were bad food for you anyways, and you stop it, it's a health change and it could happen. I had weight loss because I couldn't eat. I had weight loss because I couldn't eat stuff. I lost 10 pounds in 1 month. Now I don't mind that. But I'm not trying to be anorexic while I do it.
Yeah. Okay, so there's weight loss. There's diarrhea at night. There's iron.
I didn't know about that.
Yeah, there's iron deficiency anemia.
I have
There's unexplained vomiting. We talked about
that's because your body is not accepting it. And I think that's really funny. So it's happened to me a few times, and I'll be eating and I'll be okay, and my body's like, nope. And it just brings it all up. And then I sit back and I think about, I could be up checking for 15 minutes, or I could be in pain for 3 hours. There's a video I have, maybe back from 2 years ago, and I'm just crying in the middle of the night, like as I can feel the piece of goat go through my body. So yeah, it sucks.
There's also this is interesting, persistent pain that isn't relieved by either passing gas or even a bowel movement. That's interesting to me.
Well, you have to think about it. Again, coming back down to that analogy, you eating something and it's irritating the inside of your stomach. It's irritated. It's scratched. It's irritated. It's whatever that it is. It's the best example that I can give you guys, right? Right. So what's happening though is, like, we as West Indians, I remember how we were talking about that, about it's gas, just it's gas, just get the gas out. And
yeah,
it has nothing to do with gas. And even though you've managed to, and bowel movements can be hard, even though you've had it, that bowel movement can still irritate your stomach.
Yep.
And so that's why there's still a pain. Like I could come and have that bowel movement, and then I'm like out for an hour because I just need my body to not feel for a minute, you know? And then what's even worse is that, so you've brought up a couple of things. I've got the iron deficiency, I've got the GERD, and these play parts. Like, stop thinking that one thing here, one thing here, one thing here. It's your body. If my hand is doing this, but my feet is over here, it's still my body.
Right.
And so we have to realize that our body is one thing, and one thing can attach itself to another. But you guys, like, we need to, especially as you get older, you got to realize what it is. And I think one of the other things, we didn't look into it today, but when we're younger, we'll just eat whatever. And even if it hurts, we're like, pass gas and we're good. Here, we don't have that option when we get older.
Definitely not. We don't. Definitely not. Some other symptoms that I guess should also be looked at before you choose to go see a doctor is if you see changes in appearance of bowel movement. I know some people find it very taboo to like look after they have a bowel movement, but guys, when it comes to certain things that you're feeling in your body, the simplest things like that could be signs that something's wrong.
Right? They always say check and see if you've got red in your urine, red in your stool. It's coming out of you. You put it in. Might as well see what's coming out. It's your health.
And that's what I'm saying. And I don't know why it's so taboo for us to just take a look. Like, guys, it's our health. Like we've been saying, guys, no one's going to take care of you but you. Okay?
Thank you.
Also, how often you're having a bowel movement is also something to look at as well. So we're going to talk about some lifestyle changes and remedies. Okay. So home remedies are more suggested because of the use of medications, which I like that. Try your own little thing before they start hitting you with the prescription stuff. I like that.
That's important because the meds can actually, you got to be careful because some of your meds may actually be causing certain issues. Right. So
some options that can work is, we always say this, guys, regular physical exercise. Cutting back on caffeinated beverages that stimulate the intestine. So we're talking more like acidic stuff too, all of that stuff. Be careful when we're ingesting those. Eating smaller meals, that can also help. Last week we talked about it, minimizing stress. That is a huge one. Talk therapy might help with that. Taking probiotics, so good bacteria normally found in the intestines to help relieve gas and bloating and avoid your deep fried or even spicy food.
I'm going to add one more because Carolyn from Energy Shack, who was with us, 3 weeks ago, she's a nutritionist. And I'm not going to lie to you, Sharifa, if I didn't have her in my life after the second accident, I probably would have been in as much stress as I was the first time. But she always says to me, and I hear it all the time, and we heard it when we were younger, chew, 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 chew. You need to chew your food as small as you can. We put food in our mouth and we leave it as big chunks, and that doesn't help our body. We're actually putting more stress on our body. Chew as much as you possibly can and get it as minimal as possible. And she actually said, I need you not to do anything but eat right now. And I was like, what are you talking about? She's like, you will not focus on how you're eating, how you're chewing, how big the piece of food is. Like you do, and then you eat it. Like, and we know that we take that big gulp. And she's like, you can't do that anymore. If you don't want to hurt your body. So that's another one. Can we talk a little bit about treatment and things like that?
Go right ahead.
I love the fact that we started off with the natural remedies, the checking things out, put things in your diet, take things in your diet. But then we get to the point where, okay, well, I tried to do things on my own, but the symptoms don't improve from my home remedies. And my doctor's now suggesting that I use medication. And of course, you should let your doctor know what other things are taking place, including the herbal remedies. We always talk about that. Herbal supplements and medications, as much as herbal medicine is good, they could clash. So let them know what's going on, what you are and aren't taking. And there are some medications used to treat all symptoms of IBS, while others focus on specific symptoms. Probiotics has been an amazing thing for me. And so I've really, it's helped. It's really, really helped. Just having that and a probiotic can be vegan, can be vegetarian, can be very natural. So that's good for us too.
Right.
Yeah. Then there are things like the coping and the support. So you want to increase, you brought it up before, you want to increase your exercise level because it will release it. Like we always, I don't know if anybody else does it. Sharifa, tell me, like, you ever work out and you realize like after you work out, your bowel movements are working a little faster? My trainer, Hope, always says, that's because you're working it, like you're helping it get through. My massage therapist tells me to massage it if I'm in pain.
Hold on.
What?
Hold on. You said massage. Okay, real quick.
Yeah.
My friend, she was having issues going, and I saw her rubbing her stomach, and I'm like, what are you doing? She's like, I'm trying to massage it to see if it'll move it.
Yeah.
I didn't know that. And then you said it just now, and I'm like, is that actually a thing?
Yeah. Okay, so I'm not going to stand up, but you're rubbing your stomach. You want to rub your stomach, and you can rub it in all the different directions. You can push it from side to side. You can rub it like this. But remember, your intestine goes like this.
Right.
So you're kind of helping it go through the system. If it's got a blockage somewhere, you're kind of just gently pushing it through. I've had to have my massage therapist like massage like the sides and my back and my stomach. And like 2 hours later, I'm good. And I was like, from the time that she taught me that, I was like, you just saved my life. We're good.
I'm sorry, guys. Sometimes as we're going on the show, it's like a learning moment for us too. So wow. Okay. Learn
yeah, mama. And there's nothing wrong. You want to be massaged anyways? Might as well just massage. Or
massage in all the right places.
Just doing a little circular motion. So you can like push it, or you can just do little circular motions along it. And just 5 minutes while you're on the couch or something.
Got it.
Okay. So you were talking about some of the great coping and supports that are out there. And I think what I'm really starting to love about this show, Sharifa, is that we are realizing how much we don't necessarily, medicines are good, they help you, but medicine does not have to be the only way to help you. Yep. So we're talking about reducing the stress. Well, a doctor's not going to reduce the stress, but a psychologist or a psychiatrist, you're like, but that's my stomach. But your stomach's irritated, and your stomach's irritated because it's stressed. And that stress can be either internally from your food, or that stress can be outside from your environment. And once you learn how to alleviate stress, once you have all of these different things, and that's why you have other specialists in your life to tell you techniques or show you different things, it helps you release it. It helps deflate it. It helps deflate. That's the right word. Deflate it. So that talk therapy, what was the gut related hypnotherapy?
Can you imagine?
Mm-hmm.
Can you imagine? I never knew that existed.
Listen, and that's why we're here, family. That's why when we open up and we talk about, we want to bring awareness to the chronic pain community. We want you to live a life. Like, we sit here and we watch people on social media in our groups, and they're devastated by their life, and they don't want to live their life anymore because they're in pain. They're in pain. They're suffering. They literally want the breath of life not to be in them anymore. And I know what that feels like. And yet there are ways where you don't have to take medication. There are healthy ways that can help alleviate that pain. And if it helps even 1 or 2%, it reduces your stress and it improves your health. You keep saying alter your diet. I want people to take a look at FODMAP, FODMAP. This was the diet that was given to me, and it told you about the things that I could and couldn't eat. And really and truthfully, when I stick to it, it really does help. And it was kind of hard because they're like, you can't have rum. You can't have like the rice and the peas. You can't have like garlic or raw onion. You can't. And I was like, could you? I was like, okay, do you realize like your first 7, I'm Trini, I'm West Indian. These are the natural ingredients for the base of any of them. And then you sit back and you're like, wait, this is the base of I always put onion. I always put garlic or ginger. Wait a minute. You know what I mean? Like, you're like, you want to complain about it, but then if you step back, you're like, wait a minute. Am I adding to it?
Yeah.
So you guys, and you don't have to change everything, but if you are having pain, do not be afraid to go to your family physician and ask to see a specialist, a gastrointestinal specialist. And also take your own research. Don't depend just on your doctor to be like, well, this is who's in my network. Create your own network. Find out who's out there. Look who's in your area and try and get into their service so that you're really being taken care of someone that knows what they're talking about.
And I think too, when it comes to what we're putting in that sense, it could also as simply be a process of elimination.
It really could. It really could. Like, people don't think about, like, as you get older, I heard my mom say this, she doesn't eat meat as much anymore. She doesn't eat chicken as much anymore. She really just eats more of the fish or the turkey. Why? it's easier on the digestive system. Do you know what I'm saying? So changing one or two things, look at what you're eating.
Yep.
I mean, one thing that you don't want to admit, they're like, because I like it. I like my steak. And it's going to sound really crazy, but I had to go from being well done to more of a medium rare. It's easier on my digestive system, and I don't have steak as often, but it's a treat. And I shouldn't be putting in my body that much, but.
Right.
Yeah.
Absolutely. Okay. So we talked about a gastrointestinal specialist, which is a gastroenterologist. Did I say that right?
GI, yes.
Okay.
Gastrointestinal. Yeah. Gastro.
We're still learning. So those people, they specialize in the health of the digestive system, or the GI tract that we all know as. Another association that I really, really liked was Canadian Digestive Health Association. So they offer general information on IBS. I find it very interesting that they also have, like, if you're someone new to the IBS world of things and you're just starting to deal with it, they have Understanding IBS webinars. So it gives you...
I'm going to ask you a question. Did you know that this existed before you did the research?
No.
Do you know any people that are actually having pain in their stomach and they don't know that this is an option?
Right.
It breaks my heart, Mama. Sorry.
Yeah. But I found it very interesting, and I find it that it could be so helpful. Imagine, this is something new to you, out of the blue, you don't know where to start. I think they offer this really good service where you're on with other people who are suffering from the same thing and wondering, and y'all are learning together and building a community. And then there's also like Facebook groups for IBS where people share and interact and all that stuff. So when it comes to coping and support, we always say this: you don't have to go through it alone. You absolutely don't. But you have to be the person to reach out and want to connect and want to, advocate. And a part of that is doing your research, connecting with people, asking those hard questions, getting an understanding of everything you're going through.
I would say this. A lot of us, whether it's college, university, or whatever, a lot of us entered into school, post-secondary school, and we didn't know the end result. We just knew that I was going to come out with a degree. I was going to come out with a certificate. I was going to come out with something. And you walked into that classroom being willing to learn, being willing to have someone else that took all the years and did the study to teach you. You didn't have fear. You didn't have fear in going, I'm willing to put myself out there to learn something.
Right.
It's the same thing. And this time we're not talking about the money in your pocket. We're talking about your health.
Yep.
You can have okay, I'm gonna break it down for a minute, Sharifa, and let me just be real with our audience. We're talking about your health, and your health means the longevity of the time that you have with your spouse, with your children, with your grandchildren. Your health means the things that you can and can't do. Can you ride the bike? Can you walk? Can you go camping or swimming? Your health means, can you stretch to the and touch your toes? These are important things. If you do not take care of your health, it doesn't matter who you love. It doesn't matter how much money you're pulling in. It will mean jack shit if your body cannot function to get those things done, to love the people that you want to love. And that's why I try to tell people all the time, you have to love and take care of your health. Mm-hmm. And as much as me and you go through our pains, Mama, like we go through our pains, but we're here because we're loving ourselves through our health. And we don't have all the answers. Let me make this real clear. We don't. We're still learning it as we're pulling up information. I have IBS. I didn't even know there was a Canadian Digestive Health Association, right? I'm going to go put myself on there. Do not have fear for fighting for your life. Your health is your life. And when your health goes, so does your life.
Yeah.
So fight for it. Sorry, I know I got a little passionate.
No, it's okay. I was just gonna back you up. Some people are probably looking at Khalilah like, oh my God, like this is a side of her like we never seen. But guys, you have to understand, like when we go through certain things, we're not just talking for the sake of talking. We have lived it. We have gone through it, and we see how important it is because, like she said, if you don't take care of your health, who really cares about what your mom or your papa or your kids are doing? You're not going to be around to see them do any milestones or whatever the case is. So it's just a matter of, we're just passionate for ourselves, and we want to give you the information so you can be passionate as well to just live a long and prosperous, healthy life.
Let me put an extra check on you. What you're talking about, our families and friends, they're watching us. My mom, my girls, Sharifa, has been on the phone while I'm crying, bawling, and I can look good today. I might come on this show and be like, she looking all cute and stuff. But you guys don't, and I try to record it. I do, Sharifa. I try because part of my fibromyalgia monologues. Mm-hmm. I try to record it because I want people to see you're not the only one, but they're watching you. My mom cries and she tries to wipe the tear away while she watches her daughter, the person she gave birth to, in pain, and she can't do anything for that. My niece and nephew are worried, like every time I say, ow, are you okay? Do you know what I mean? The family and friends that you're sitting there with, they're watching you and they're suffering with you. So if you don't stand up for yourself, you're still hurting them too. You're not just hurting yourself, you're still hurting them too. You're hurting your interaction with them. You're hurting the time that you have with them. You're actually, in fact, showing them whether or not to stand up for themselves. How you let your light shine gives authority to other people for their light to shine. Mm-hmm. Okay. I'm getting all passionate today, my bad.
I mean, you're talking fast. There's a lot going on personally. You're talking absolute fast, but
yeah.
Okay, let's dive right into our keep it moving moment.
Keep it moving.
Okay, so our keep it moving moment today is: not all scars show, not all wounds heal. Sometimes you can't always see the pain others feel. So I'll read it again. Not all scars show, not all wounds heal. Sometimes you can't always see the pain others feel.
Oh man, Rifa, I feel like that is like the anthem for depression. I feel like that's the anthem for
it's a general anthem.
It's disabilities. I was like, I'm taking that post and I'm running with it. Running with it.
Absolutely.
I love that you found it.
Okay, so that was our keep it moving moment. Let's wrap up the show with some final thoughts today, Khalilah. Let me have it.
Oh, you really want more final thoughts for me? Okay. Let's talk about IBS, you guys. If your stomach hurts, if putting food into your stomach at different times, and it doesn't have to be consistently every day, but if you put food into your stomach and it's hurting you, if you do the things like we said, like even after you've passed gas or you've had a bowel movement, we're going to call it what it is, and you're still feeling pain, acknowledge that something is wrong with you and go to the doctor. A person cannot get into the emergency room until they acknowledge that there's an emergency. A person can't go to the doctor until they acknowledge that they've gone to the doctor. A person can't get what they want in life, period. I want to be married. I want to be happy. I want to be X, Y, and Z until you acknowledge that that's exactly what you want. So if you're going through something, it might be scary, but it is better for you to know the answer so that you can be able to put the system and the community that you need to actually get you to the place where you want to have happiness. That's my final.
I just wanted to add to that too. I think all in all, what I'm thinking, because we think about, like, we talk about bowel movements and cramping and you get that little pain, but sometimes we don't think it's bigger than what it is. And I think ultimately what I've taken away is that in general, no matter how small a pain might be, if your gut tells you something's wrong, it doesn't hurt. I'm sorry. I wasn't trying to play on words there. I really wasn't. But if you have that feeling that something's wrong, it doesn't hurt to get it checked out. You'll go get it checked out. Might not be nothing, okay, but it just goes to show that you got to stand up for yourself no matter how small it is, guys. No matter how small it is. I love that show. It was really good today.
I really love it. And, you guys, we are just asking you to share Share within your networks, share within your groups on Facebook, tag up information that you like. But, you know, it was really funny. Me and Sharifa, we do this, like, even in the middle of our pain. Sometimes you don't know it. Sharifa's in pain today, you guys. You know, she's already said it. And we stand up right now every Tuesday at 12 p.m. Eastern Standard Time because we know what it feels like. And so please make sure that, you know, you share this with someone that you know might feel like this, because like she said at the beginning of this, as much as it might sound small, but 1 to 3% of the world, you said, Sharifa, of Americans, they experience this. Yeah. And you also said there's probably at least one person that you know that is dealing with this. Yep. And you might know who that person is, but knowledge is power. So empower your community.
Absolutely. Absolutely.
Yeah. So I know I completely got off track, didn't I?
No.
Okay. So let's just put it this way. We are closing up here. And so we want to just simply say thank you for joining us for another Chronic Pain Conversations, like honest to goodness. Next week, I'm kind of actually excited about this. We're talking occupational therapist. And I'm really excited because I know that sometimes we've started bringing on the people that know how to have these conversations or to help us. And there's a lot of people that don't know what an OT does, who an OT is. And so we don't have a guest on next week, but we do have a lot of great information. So be with us next week. Be sure to follow us on Facebook, YouTube, and Instagram at CP Conversations. And if you're a chronic pain sufferer who would like to share your story, we invite you to be our guest. We're looking for MS survivors. We're looking for a lot of different things. Also, follow us and you can be our guest, and you can go into our link to fill out that information. And finally, like we always say, have a blessed day. And remember, Chronic Pain Conversations is the show that enlightens and advocates about chronic pain. Have yourself a very blessed day.